I'm in the HydraFacial room. I'm so excited. I have not had one of these in over a year, and I kind of forgot how good they are, but my patients are just obsessed with them. So I gotta see what the hype is about. HydraFacials are an incredibly popular skin treatment, and my patients, as well as my Instagram followers, ask me quite often if I recommend them. So let's talk about it. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist. I'm here to help you understand your skin and find skincare products that work for you. If you like what you see, like this video and subscribe to the channel. First of all, we should talk about what a HydraFacial actually is. So this is a hydrodermabrasion treatment that is very customizable, but carries out 3 distinct steps: cleansing the skin, exfoliating the skin, and then infusing the skin with various treatment serums based on what your skin goals are. And if you're thinking, okay, great, but what is hydrodermabrasion? Think of it this way. Microdermabrasion uses grit or friction to essentially buff the surface layer of skin cells and exfoliate it that way, whereas hydrodermabrasion uses a very gentle vacuuming or suctioning technology to clear out your pores while simultaneously pushing active skincare ingredients like exfoliating acids into the skin. So with a HydraFacial, you're essentially getting some very mild mechanical or physical exfoliation while simultaneously getting a chemical exfoliation treatment. My esthetician sort of described it to me as like having a carpet cleaner for your skin, and I love that image so much. The other thing is when you think about a traditional facial, you might think of having extractions done, which is essentially pressing on or manipulating the pores in a way to extract unwanted debris and reducing inflammation. And it's not to say that doing extractions in that way is bad, but it can be a lot more aggressive on the skin. As a dermatologist, I have seen people come in who've had extractions done who have long-term scarring from it. And of course, that's not very common, but when it does happen, you just feel so much for that patient because they were trying to do something good for their skin and they ended up with a long-term problem because of it. Where if you think about a HydraFacial, you're still doing that type of extracting of the pores, but not by pressing or pushing on the pores. So it's considered to be a more gentle treatment. And before I understood the nuances of the HydraFacial system, I thought, okay, well, does vortex vacuum suction technology, is that really that much more gentle on the skin? But the nice thing about HydraFacial is that you can really change the suction degree based on the person's skin quality, or if you're working in a delicate area like around the eyes, you can reduce the amount of suction and tailor it to the skin that you're treating. And then other things you might want to know just generally about HydraFacials is they're typically recommended to be done every month or so, but of course they can be spaced out however you really want them to be. The other thing is they tend to cost somewhere between $199 and $300, and that varies based on what type of treatment you're having, if you're having any special boosters during your treatment, which I'll get into that in a second. And then HydraFacial typically lasts somewhere between 30 and 60 minutes. And again, that is dependent on what type of treatment you're having. And then, what are the benefits of a HydraFacial? And I should say, this is not an ad for HydraFacial. This is just what they are known to be good for. And one is acne, another is improving the sign of wrinkles, and the third is helping with hyperpigmentation as well as just general skin inflammation. Let's get into the specifics. There are 3 distinct steps or parts of a HydraFacial, and step 1 is called cleanse and peel. So this is the step that's sort of using that mechanical and chemical exfoliation that I talked about earlier. So the mechanical exfoliation is that little bit of vortex technology, and then the chemical exfoliation is sort of twofold. Initially, there's this lactic acid based preparation that's put over the face in order to soften up the sebum, so the oily excretions that fill your pores and can make them look large or dark. And then after that, you get this what's called a glycol preparation infused into your pores. And glycol stands for glycolic acid and salicylic acid. And there are 3 strengths of this glycolic acid, salicylic acid based solution. One, and the most gentle one, is 7.5% glycolic acid with 2% salicylic acid. And then the strongest preparation is 30% glycolic acid with 1.5% salicylic acid. During my HydraFacial treatment, I got the 30% glycolic acid solution. And that was really based on 1, my skin concerns, but 2, the fact that my skin is not new to exfoliation. And I knew that my skin would be able to handle a higher preparation of an acid. The whole point of using two different types of acids, so glycolic acid and salicylic acid, is that they do slightly different things. Glycolic acid is a pretty potent alpha hydroxy acid, and the goal of that is really to break apart the dead skin cells that sit on the skin surface and can make the skin look dull. And then the salicylic acid is a beta hydroxy acid, and the purpose of that is really to get deeper into the pores, break apart some of those fatty excretions as well as those skin cells, and really just clear things out. And so having the duo is really important in getting a full resurfacing of the skin that's both gentle and effective. If you've ever thought about getting a chemical peel, but the thought of that sort of intimidates you, I feel like this is a really good option that sort of sits between at-home chemical exfoliation that you can do with your skincare and then a full-on chemical peel that you might have done by a physician or nurse or esthetician. So you're getting a lot of exfoliation, you're getting exposure to high-potency acids, but in a slightly more gentle way that's not going to inflame the skin and in a way where you're not going to peel afterward, which makes it convenient for doing this one day and then being able to go about your life the very next day, which you can't always do with a full-on chemical peel. So once you are done being cleansed and exfoliated, step number 2 is called extract and hydrate. So now that the skin has been appropriately exfoliated and those skin cells and that sebum have been softened up with exposure to those alpha and beta hydroxy acids, that's when you go in with just this suction itself and really pull any of that excess sebum or debris out of the pores. And the cool thing about the HydraFacial is when it pulls that out, it collects it all in this little watery basin. So at the end of your treatment, you can look at all the stuff that came out of your pores, which I found immensely, immensely satisfying and just a little bit gross. This is also the point in a HydraFacial treatment where you could have a booster serum applied to your skin. So I had the Senti Dermal Repair Booster done, and that's really to help with hydration. I feel like recently my skin has been particularly dry, and with all that exfoliation, I really wanted to be sure that hydration was maintained after the treatment. But other types of boosters are things that have peptides or growth factors if you're trying to have more of an anti-aging treatment. And then there's also a brightening booster that can be done, and that has vitamin C and alpha-arbutin and bearberry extract, all things that help the surface of the skin appear more glowy and make the tone appear more even. I think having a HydraFacial treatment just with the standard sort of interventions without the booster would still be awesome, but adding that booster in just made me really feel like this treatment is tailored to me and I'm going to get exactly what I want out of this HydraFacial. At this point in my HydraFacial, everything felt very calming and my skin didn't hurt. There was no stinging or anything like that. I was a little concerned that my skin was going to be super red at the end of treatment, just between the combination of exposure to those exfoliating acids as well as the mechanical exfoliation. Because I have rosacea, I have sensitive skin at baseline, I am super prone to redness. So I was a little panicky about that. But then Caitlin came in with LED red lights, which really help with inflammation and are supposed to be collagen stimulatory. And we did a treatment with the LED light therapy after those first 2 steps. And one, that was just incredibly calming mentally, but it also made my skin not so reactive, and it made my skin after the treatment just look glowy and not inflamed. Which brings me to step 3 of a HydraFacial treatment, the finale, which is called Fuse and Protect. This is where you get your final pass with the HydraFacial wand, and a combination of proprietary antioxidants and peptides are infused into your skin so you have that finishing glow. Also, at the end of the treatment, my esthetician applied sunscreen to my skin to protect it. Of course, you have all of that baby soft, sensitive, vulnerable skin, so you want to protect it with sunscreen. And then she applied the Laneige lip mask, which I adore. So I was just hydrated, moisturized, protected, all the things. So those are the 3 steps of a HydraFacial treatment. And although this is a very gentle treatment that I think most people could do and benefit from, there are certain groups of people who I would say should probably stay away from HydraFacials. And those are people who have active skin inflammation that is moderate to severe, or those with a compromised skin barrier. So what does that mean? That can be like severe acne, uncontrolled rosacea, an active sunburn, an active cold sore outbreak. Any of those things I would not recommend getting a HydraFacial until they are under control. And then other things you might just want to be aware of, if you are on blood thinners like aspirin or other anticoagulants, because there is this vortex or suction technology with the HydraFacial, you just want to let whoever's doing the HydraFacial know so that they can turn the suction down. Otherwise, you might get like a little hickey from the HydraFacial device. Also, if you have an allergy to shellfish that results in a skin rash, you just want to let the HydraFacialist know as well, because one of the skin preparations has an ingredient called glucosamine. And for people who have shellfish shellfish allergies, occasionally that can cross-react. And then the last thing is if you have a seizure disorder, you just want to let your esthetician know as well, because they may skip the LED light therapy part of that because that has been known to induce seizures in some people. Other questions that commonly come up are, hey, I'm pregnant, can I get a HydraFacial? And although the HydraFacial company does not say, yes, this is safe in pregnancy, they leave it up to the practitioner or the doctor who is supervising that patient to decide whether they're a good candidate for HydraFacial or not. I can tell you I have several patients who are pregnant and I'm totally okay with them getting their HydraFacials done. Of course, the esthetician is aware of their situation. But I think it's actually a really nice thing to be able to do for yourself while you're pregnant, because you can't get Botox, you can't do fillers, you can't do your lasers, and HydraFacial is a great way to still maintain your skin during that part of your life because so many other things feel like they're off limits. Another thing my patients ask is, I just had Botox and fillers done, when can I have a HydraFacial? And I usually recommend my patients wait about a week after any injectable treatment before they have a HydraFacial. Now, the reverse is a little bit different. If you have a HydraFacial, you can get Botox or fillers right afterward. And that's very common in my practice for my patients to have a HydraFacial with our esthetician and then come over to me and have their injectable treatments immediately afterward. Okay, so my final thoughts on HydraFacials. I personally loved it. I felt like right afterward, my skin looked glowy and refreshed and decongested, which is amazing because there are just certain pores that I cannot clean out. And the HydraFacial did that for me. And then my skin continued to look better day after day after the HydraFacial treatment, which was unexpected. I didn't expect that my skin was going to continue to look better the day or two after my HydraFacial treatment. So having some longevity in the results was impressive. That being said, I wouldn't go into a HydraFacial expecting it to be the most relaxing treatment of your life or the most relaxing facial. You know, there's no facial massage. Of course, there's sort of this spa-like ambiance and music, and it's very calming, but you should just know it's a medical treatment. You're there to get results. And so it's not just about the relaxation and the sensations, it's also about getting some good work done. And the last thing I'll say, just because I know someone is going to ask, is a HydraFacial worth it? Or in general, are facials worth it or needed? I always say the same thing when it comes to worth it. It is not for me to decide what is worth it to somebody else. All I can do is educate you on the experience and what it's like, and then you have to decide for yourself whether that's worth it to you based on what your priorities are. Are you a fan of HydraFacials? Tell me in the comments, and make sure to give this video a thumbs up and subscribe.